it's been a great day so far. So those of you who have been here all day have heard some really inspiring talks. So I hope to be inspiring and thought-provoking. So I actually sort of tweaked my title when I started here because I thought maybe we need to think about think globally, act locally, or maybe both. You know, maybe that's the way we should go. So where did this whole term come from? So these kind of talks are a great reason to sort of dig in and sort of say, where did these things come from? So I went to Wikipedia, which is where you start, right? So you can start with Wikipedia, but remember you can't stop there, okay? So just let's make that clear. So think globally and act locally, really, the origins are in dispute, like a lot of other things like this. And so there's some discussion that it had started in 1915, or that maybe in the 60s and 70s. But regardless, it was pretty clear that it came from environmental and town planning. So if you think about the environmental movement in terms of thinking globally and acting locally, where could you have an impact in your local environment? So that makes a lot of sense when you think about it. It's really been applied a lot to global health and global health activities. And so that derivation is even less clear than the other ones. Wikipedia was no help there at all, I gotta tell you. So the issue with this is, what is global health? So when people talk about global health, we think about it being, we all think we know it until we actually try to define it. If you think about it as being the health of a population in a global context, think about population, it could be the global population, it could be a local population. So population is a very broad term. But if you think about it in terms of what we're trying to do with global health, worldwide health improvement, reduction of disparities, and then protecting against global threats that disregard national borders. The classic example right now that we're dealing with, of course, is Ebola, right? So when the Ebola thing was happening last year, this national border thing was irrelevant. Ebola didn't respect any borders. So when we think about global health and why it's important to us, it becomes pretty clear that we're only one flight away from somebody bringing something here or us taking something somewhere else. So I get a lot of students who say to me, I really want to do global health. And my first question is, what do you mean by that? What do you want to do? So there are lots of options for students, and I tried to lay out a couple examples here. Mission trips. How many of you have been on a mission trip where you go someplace and you help to build houses or schools or do things like that? Okay, great. Has anybody worked with an NGO? A non-governmental organization, NGO. Doctors Without Borders. MSF is the abbreviation because it's in French. Doctors Without Borders is an example of an NGO. So nobody's worked with an NGO. How many people have done study abroad? Yep, great opportunity to learn. There's lots of other kinds of things you can do if you want to do global health. There's actually more opportunities, however, for people who are graduates, because then you can actually work with NGOs like the Peace Corps, like Doctors Without Borders, and some of those kinds of places. You can work for some of the global organizations, the UN, the WHO World Health Organization. You can work for these kinds of places once you're a graduate. A lot of those kinds of places have opportunities for interns, especially at graduate student level. So if you're a graduate student or you want to do global health, this is an opportunity once you're a graduate, once you have a bachelor's degree, you can actually, as a graduate student, then do a lot of internships. So it's a great opportunity if you want to do global health. And this is not just restricted to people with health professions educations. NGOs need engineers, they need business people, they need computer scientists, they need people with lots of different kinds of skills. So don't think about just restricting yourself only to health professions, because there's lots of these kinds of things where there's intersectoral communication. So environmental people work with health people, for obvious reasons. Education people work with environmental people and health people. So there's lots of opportunities there. So here's the other thing that I get asked a lot. How do I find a group that's going to let me do what I want to do? So there's no one repository. There are tens of thousands of NGOs work in health alone. You can be in a country, and anybody who's done this kind of work has had this experience, you can be in a country working on something and you run into somebody in a casual environment who's doing the same kind of work you're doing in parallel, but you don't know about each other. So after disasters, it's not uncommon for NGOs to all sort of go into a country and they end up tripping over each other because there's so many of them and there's no coordination. Okay? So there's no one repository for these things. The best way to do it is to sort of Google away. You know, so Google away for the NGOs, but the questions to ask yourself, and this is where I've had some amazing stories told to me. Try to find out what the focus and mission of the NGO is. Make sure it's something that you're consistent with. Sometimes these are religious organizations, so sometimes the religious organizations have a mission to do things that are focused on the religion while they're also doing good work. That has to be okay with you. Because I've had some students who start with an NGO and they realize the religious mission is more important than the work for that group, which is their choice. But that's a problem for the person who's joining the NGO without thinking about that. How long have they been in operation? You know, you can start an NGO. I can start one tomorrow. The other thing that happens is make sure there's cooperation with local governments. I had a student come to me and say, I found this great NGO. I'm going to go to this country, which I knew at the time had a civil war going on, and said, I'm going to go work with this NGO. And I said, where do they stand with the government? How long have they been in business? Well, they're brand new. And I said, and so where do they stand with the government? Well, they're working with the guerrilla group. And I'm like, you don't want to go into a country with a guerrilla group doing good work. You know, you want to make sure that you're going in with the government knowing. So try to reverse the situation. Would we want people coming here sort of work with folks that were sort of against the American government? It would be uncomfortable for us, right? In the same way, what do the students or volunteers do? I had a student very proud, she became a nursing student, who very proudly told me that she had worked with an NGO in a country that was considered a developing world country, and she was delivering babies, and she was very proud of that. And I said, what kind of training did you have? She said, I didn't have any training. I was frankly horrified by this, because if you think about, if we had a natural disaster here in Cleveland, let's say a flood, and it was on the scale of Hurricane Katrina was in New Orleans, and all of a sudden a bunch of people from another country who had no training started showing up and providing care to us, we would be horrified by this, wouldn't we? We would want people who had training. So just because you can do something with an NGO doesn't mean you should. Okay, so sort of pay attention to what kinds of things the NGO does and what kind of training they provide you. Because if you're going to be providing actual care, you really need to have the training. In the same way you need to work with the government, right? So this is the kinds of things to sort of ask. How many students or volunteers have they worked with? Because if they work with lots, that's a really good sign. That means they're organized. They know how to get people where people can stay. They know where to get food. Americans, we're not exposed to a lot of sort of the intestinal parasites that a lot of the rest of the world deals with all the time. So our food may have to be different sometimes than the people eat locally. So they know how to deal with all these things. So if you're looking for NGOs, these are the kinds of things you want to look for. So why should you do global health? There is nothing like it in terms of learning firsthand how lucky we are to be in the US. So I come home and I'm so grateful to be here. I'm so grateful that I have had the opportunity to do other things, but I'm so grateful to be back. And so when my children were young, they were not always happy when I came back, because I would say, do you realize how lucky you are? I mean, I was like on this tier. Do you realize how many benefits you have here? I mean, it was not always a pleasant thing for them when I came back. I would be overwhelmed at the grocery store. I'd go to the grocery store and be like, why do we need 47 kinds of cereal? Right? So it's those kinds of things that you get sort of hung up on. It gives you a better understanding of the issues facing people in other parts of the world. You know, you can read about something, but to actually sort of experience it with someone, or to actually hear their stories, tells you in a very different way how the world works. And there's no other reason to really appreciate it more. I think the other piece is that you get a really good understanding of yourself. So there are a lot of people who say, you know what, I'm pretty resilient, I can take it. But after so long, sometimes in a place, you're like, you know what, I can't take it anymore. And that's okay too. It's understanding yourself, right? What's okay with you and what's not. And actually, the benefit is you actually learn you can actually do more than you think you can. That you can go without a smartphone, right? You can go without data on your phone. It would actually be okay. You can actually survive that way. But the other thing is I think it also gives us a more critical understanding of what we don't necessarily do well here in the US. When I look at all the resources and things we have, and I look at how things are in other parts of the world where they do as well as we do or better on some health indicators, it feels to me like we're not taking full advantage of all the opportunities we have here. So this is where I think it gives you sort of that balanced understanding. There are some things we do great in the US. There are other things we have a ways to go. And this gives you some sense about that. And you learn from the people in the other places about how they do it. And that's the other thing. I've learned a tremendous amount from my global health work in terms of what we could maybe do better here. So I'm going to give you a couple places. We're going to look at a couple places so you can sort of think about it. So the first place I'm talking about has about a 35% poverty rate. 35% of the people live below the poverty rate. The maternal death rate is 28 per 100,000. And infant mortality rate is 12.9 per 1,000. These are the standard denominators for this. For the infant mortality rate, however, this first place has some that are as high as 26.6. Okay, so you got those sort of in your head? All right. Second place. Percent living below the poverty rate, 3.8%. Not bad, right? A lot better than 35. But the maternal death rate and the infant mortality rates are, the infant mortality rate is actually better than the first place, right? So do you know where we're talking about? You got a sense? First place is Cleveland. Second place is Malaysia. So what I wanted to give you here is I wanted to give you where those numbers came from so that you could see. Now I understand it's not always fair to compare a city to a country, right? Because there are parts of Malaysia where there are deep pockets of poverty as well. But I just want to put things in context. Because I think sometimes we do global health with the intent, and this is a very honorable intent, of wanting to make the world a better place. Well, you can do that right here. You can do that right here. So where can you have the most impact? Where as an individual can you have the most impact? Here or there? Where do you think? How many people say here? Yeah. How many people say there? You can have impact there too. But why can you have impact here? What can we learn about how things are done in more resource-constrained countries? We can learn a lot. Like I said earlier, we have a lot to learn. So if we think globally, right, and we act locally, this is where we have an opportunity. Are there any of those lessons you can learn in other countries that we can use here? Absolutely. Absolutely. The speaker before me who talked about being in South Africa, I'm sure you learned things that we could do here better to make things better in terms of apartheid and racism, right? So what can you do to impact the health of residents here? Well, this is timely because it's that time of year. You can vote. You can't vote in Malaysia. You can't influence how things get done in Malaysia through your vote. You can here. Get involved in local groups. We need your time, energy, and passion just as much as the rest of the world does. There have been some folks who have talked about, so Lee Ponsky earlier today talked about working with MedWish. MedWish is a local group. They usually meet here, right here on campus or somewhere close by. Do you know MedWish? Right. So MedWish is a great opportunity. The student-run free clinic, the medical students, dental students, nursing students, and social work students work at the student-run free clinic on every 2 Saturdays a month. There's opportunities for student-run free clinic. There's lots of opportunities here, and again, it's regardless. We've had nursing students go with Engineers Without Borders to do mission trips. There's lots of opportunities to do things here as well. Find a cause and volunteer, and remember that the people who are the community experts, right? The people who are the people living in the community are really the experts at what works best there. So that your intent about coming in and doing good things is really a very good thing. But learn to listen and take from them what they've experienced, because sometimes they get sort of volunteer fatigue. There's so many volunteers who come in and they all say, what if you did this, what if you did that? They're like, these folks have been through these kinds of things multiple times, right? They know what works there. They know what's not going to work there. What they need is your help, right? Because they're the experts in their communities and making things better. So let me give you an example. So this is one of my students, Diana Cavasso. Diana, when she was an undergraduate student at the School of Nursing, did her public health capstone in St. Lucia. St. Lucia is one of those lovely tropical islands where a lot of honeymoons and tourists go. That's not where she was. She wasn't on the resorts, right? She's out in the communities. And so that's where she did her public health capstone. This gave her the bug to do global health work. She has since been in Thailand working with human trafficking victims. She has done work in Haiti. This is from Haiti. And so this is where Diana goes, and she does different things at different times. She loves this picture because she had a great experience in Haiti. The other thing Diana does when she's here, however, in the U.S. is she talks about human trafficking. Human trafficking is a problem. Ohio, actually, whether you know it or not, is a hotbed of human trafficking. And so one of the things she's doing in health professions, physicians, nurses, lots of folks, our state boards have a focus on human trafficking to help get us educated about what does this look like, how can we help be the first line of identifying people at risk. So that's what Diana does here. So she does things locally, she does things globally. It's a great balance, right? So that's what we're looking for, is for you to do both. Not one or the other, but both. So it's not an either or, it's a both and. And so if I have nothing else to tell you, it's like, use your efforts to help the rest of the world, but also work here. And with that, I'll stop.